TV. And with me today is Fiona Angel. Some of the things that I do is I watch these, as we all do, these little startups that all seem to explode out of the Stanford dorms. And so you were kind enough to come down here today and visit with our system of care. So tell us a little bit about what you do and how you came to do it.
Yeah, so I'm Director of Account Management at CareMessage. I've been there since June, but I started off actually working for CareMessage as a volunteer in a previous iteration back in September 2011. The co-founder Vineet Singhal and I were on dorm staff together, and I helped out here and there. And a few years down the road, he actually texted me, said there was an opening, and been there ever since.
So SomeYoungKids.net exploded out from another Stanford dorm.
Yeah.
Kind of like Google, only
maybe
but with a good heart there. So
we aspire.
Yeah. So tell us about CareMessage.
Yeah.
Because you got excited enough to do this as a volunteer.
Yeah. So CareMessage is a texting platform, and we're a nonprofit. And our aim is to allow doctors and other care providers to communicate better with patients. So we accomplish this via text, right? And it's not smartphone only. Any phone really works, because we are trying to reach all segments of the population, not just a subset who can afford smartphones, but really everyone. So we really do have a focus on the underserved, who maybe don't have managed care around the clock, but who need it. And so this is sort of an in-between for them. We can get into some of our features.
Well, nowadays as a physician, the hospital discharge doesn't end at the time they walk out the door. It's 30 days after. We really need to keep these people educated on how to stay out of the hospital, how to come to appointments and get their medicines, get their tests done. If there's nothing that frustrates my doctors more. So how does CareMessage, how do you guys help us out?
Yeah, so first of all, we have appointment reminders. So if you do have follow-up appointments, and especially if they have to get some labs done or bring in some other forms of paperwork to the appointment, providers can send out that message saying, hey, come in next Tuesday and make sure to bring your x-ray or whatever it is. And we can collect an RSVP from patients. So instead of spending the time making calls during the business day to try to get patients to come, you can just send out a text, they'll look at it, text back yes or no, and there you have your answer. We also have some health education programs, right now mainly focused on chronic conditions, so diabetes, hypertension, high cholesterol, COPD, probably about 6 others that I'm not listing right now. And those are designed for generally newly diagnosed patients who come home, they get this diagnosis, and they may freak out, or they may not be able to take in all the information that the provider is giving to them. So over a period of 1 to 4 months, they can get daily or every other day text messages saying, hey, did you know this is how you should be checking your glucose, or this is what your numbers mean. Great job, you're in the clear, or ooh, maybe you should call your clinic and see what's going on. Beyond that, we have a lot of other texting features which can be useful for doctors. We have a survey tool, a event reminder similar to the appointment reminder, but that could be for a scheduled course, like a nutrition class, a walking group. And we also include group outreach. So if you have a specific subset of your patient population that you want to target, maybe you're giving out free flu shots, and you really want to reach out to the old and the young first. You can select those groups, and then from then on, keep increasing your group size. So there's a lot of different ways you can customize CareMessage to fit your needs, and that's what we're doing with you.
Well, this morning I wanted to bring you by our clinic system, because we went to the Diabetes Center of Excellence. We have Dr. Terry Cho there, Dr. Catherine Sever, certified diabetes educator, certified diabetes educator, dietitian, social worker, and the MAs are as important. And I think that's what was fun to me, is as they're weighing somebody in, they go, oh, you brought your meter today? And he said no. He didn't bring his glucose meter for them to download into the computer. So even a message, something as simple as that would make that visit so much more valuable.
Exactly, and you could set that kind of message where it says, you have an appointment next Wednesday, don't forget your glucose meter, and then even the day before or the day of, send out follow-up saying, great, we'll see you soon, bring your glucose meter.
Well, what's been your experience in other healthcare systems, and whereabouts have you been?
Yes, so I've mainly focused on the free and charitable clinics we work with. We have a large number of them in North Carolina and Texas. They have strong state associations, as well as a few others spread out across the country. And so those are slightly different settings. Most of the patients aren't paying, or if they are, it's a very small nominal fee. And it's populations that traditionally don't get, maybe the best access to care. This free clinic is their only lifeline, and hopefully if they get a referral to a specialist for free, that's the best they can do. So we've been working with them to really focus on the preventative aspect. And we actually just finished up a study at a free clinic in the Bay Area, which we're excited to hopefully soon publish the results. But it was, again, underserved population. I'd say at least 60% Hispanic, and in San Francisco, the city itself. And we expected going in, okay, will everyone have a phone? It turns out everyone had a phone. Okay, well, do they have unlimited texting? Pretty much everyone did. And sort of the anecdotal evidence we've gotten so far was that these patients who previously were not the best at managing their sugar levels or their cholesterol, after just a few months of texting, they came in with printouts of information that they got from their workplace saying, look, I've researched this about my condition, giving it to the diabetes health educator and saying, you'll help me, I want to do better, I want to be around for my kids, I want to be able to run after them, I want to be able to do X, Y, and Z. So.
Well, that's really, it's not just a matter of an external brain, or we have some things we're working on where the machine is talking to the cloud and then comes back down and has a message. But a lot of people, when you have a machine, mankind interface, go, that spells mommy, and I don't want my mommy bothering me all the time. So how do you get away from that mommy effect where people feel like you're too far into their lives?
So we have a few ways around that. One is, if they really can't handle any message at all, they can always text stop, and then they're out of it. But obviously we don't want that to happen. As far as the health education programs, the messages are actually spaced out, usually every other day. And they can really be specialized to whatever that provider wants, but we recommend every other day and only during the week. So, it's not too overwhelming. They usually stop after.
And so there's some engagement there, so they respond to the message with a yes or a no?
Yeah, so there are some health tips that don't require a response, like, tip, try walking down the block today, something like that. There are others, though, that are questions, like almost like little quiz questions or trivia questions that are true, false, yes or no, a numerical response, or multiple choice, A, B, C, D. And we try to make them, even if they may get false when it's true or something like that, we try to make the response back very encouraging so they feel like they're actually learning something and they can take that knowledge and apply it to their everyday actions.
I know there's something you want to be when you grow up there.
Yeah, I'm applying in June to medical school.
So this will, of course, add onto your resume. What are the in terms of, we had a great show with education of a neurosurgeon, where it's really 28 to 32 years of going to school to get there.
Yeah.
And so how are you preparing yourself for medical school? What kind of medical things are you doing? You're doing this care messaging. So
as an undergraduate, I majored in public health. Mainly focused on global public health. I studied abroad in Moscow and really was into studying HIV in a biopsychosocial context in Eastern Europe. So that was really my focus. Towards the end of senior year, a very life-changing event occurred. There was an accident outside of my dorm, and long story short, me and this other girl ended up keeping a man alive until the ambulance came. So after that, I said, whoa, this is a sign. No one else ran out to help. I always had this little voice in the back of my head that said, you should go to medical school, you should go to medical school. But I never thought I was good enough. once this happened and I realized, oh, okay, maybe I have something here, I ended up volunteering in Israel on ambulances, and I was so excited every night. I loved it more and more. People would make fun of me as I would talk gleefully about, some probably traumatic cases. But after that, I came back and started applying to post-baccalaureate programs to finish up the pre-medical requirements that I hadn't done as an undergraduate. So I'm nearing the end of those, and now I'm working for CareMessage and applying in June. So that's my path there.
Well, we'll make sure they see this YouTube.
Yeah, send it out to admissions.
Passionately, yes, you need to accept this young woman into your medical school. So where does CareMessage see itself going? How's it funded? I mean, this is when I saw the emphasis was on nonprofit and not just to make the next Google alien dollars there. So how is Vineet working in the world there? Do you know enough about their finances?
Yes, Vineet is a master fundraiser. He has gotten in touch with some really great players who've been very generous. They see the potential that CareMessage has, and ideally we don't want to be forever run by donations. Our goal is to grow our free clinics with our paying clients sort of in tandem, so that the paying clients can subsidize the free clinics. So that's sort of our goal there.
Well, there just with the clouds, there does seem to be some real savings as you get the numbers up there. I mean, we started somewhere around 50 cents a patient a month in terms of just the cloud expense, and get down to pennies as you get into the thousands and tens and hundreds of thousands. So it's something we're looking forward to. Well, we're looking forward to having CareMessages part of how we help our patients and help participate with them in their health care. I want to get away from sick care. So anyway, thank you so much. Thank you so much, Fiona. And Ventura, it's time for you to get moving, get health, don't get sick.